Once the pre-anesthetic tranquilizer has had time to take effect, the patient is brought into the surgical suite. A short-acting injectable anesthetic is administered into the vein. This will produce a peaceful unconsciousness in 5 to 10 seconds. Alone, this injection will produce anesthesia for only a few minutes. An endotracheal tube is placed into the trachea or windpipe. This allows the patient to be connected to the anesthetic machine so that she will breathe only oxygen and anesthetic gas. So long as the patient breathes the anesthetic gas, she can be kept under anesthesia. This allows us more control over the amount of anesthetic delivered. An airtight seal is created by inflating the cuff on the endotracheal tube. In this way, should the patient regurgitate while under anesthesia, nothing will reach the lungs. The patient is placed in the proper position for surgery, and the surgical site is clipped free of hair so that it can be more easily disinfected. In high-risk patients, we use other tools to monitor vital signs and to help these ill animals remain stable under anesthesia. One of these tools is called an esophageal stethoscope and amplifies the patient's heartbeat and breathing sounds so that they can be heard by everyone in the room. We might also use a thermal support system to help maintain the patient's body temperature during the longer surgical procedures, or on patients who are critically ill and cannot regulate their own temperatures. Patients who carry a high risk of anesthetic complications, such as circulatory collapse or cardiac arrest, are kept on a constant drip of fluids through an intravenous catheter. This gives us rapid access to the bloodstream to administer emergency medications if the need arises. Once the hair has been removed, the surgical site is thoroughly cleaned and disinfected to diminish the chances of post-surgical infection. The surgeon thoroughly scrubs his hands and arms with the same disinfectant as used on the patient. A sterile surgical pack is opened and the instrument tray is prepared. Each pack contains the necessary surgical instruments, and a freshly sterilized pack is used for each surgery. Sterile disposable items like drapes, suture material, and scalpel blades are discarded after each surgery. Sterile disposable surgical gloves are used for every surgical procedure. The instruments are organized on the tray prior to beginning. The sterile drape is placed over the surgical site to create a large, uncontaminated field.